Good afternoon. I'll start with a short update on our COVID-19 pandemic response. I am pleased to say that the outbreak at the Winter Road work site is over, and this was a work site that was managed by a contractor for Gachagua mine. There have been no additional cases of COVID-19 since February 1st. All remaining contacts from the outbreak have completed their 14-day self-isolation, and all 3 cases have fully recovered. We have one confirmed COVID-19 case in Yellowknife of an out-of-territory seasonal worker that was announced on Tuesday. We also continue to monitor the outbreak at the Gachagua mine that was declared on February 3rd. There have been 19 confirmed COVID-19 cases related to the Gachagua mine outbreak. 11 of those have recovered and 8 are still active. There have been 3 hospitalizations related to the Gachagua mine outbreak. Due to patient confidentiality, I won't be providing any more details on this at this briefing. However, these hospitalizations are a stark reminder that we must take this pandemic seriously. And that is why we have put these public health measures in place and why they need to remain in place. We still have work to do to defeat this virus. Public health officials have been working closely with De Beers Canada since the first positive cases were confirmed and have been working hard to contain this outbreak and reduce risk. We remain cautiously optimistic the situation has stabilized. Hard work and close collaboration by public health officials and the mine has helped us fight this virus. But we can't forget the workers who have had to isolate during both of these outbreaks. Self-isolating is tough. The workers who have diligently stuck to their isolation protocols have not only done it to keep themselves healthy and safe, they have done it to keep their families, friends, co-workers, and their communities safe. I want to acknowledge the sacrifice they have all made. Without that, we could not have controlled these outbreaks like we have. Now, I would like to talk briefly about our COVID-19 vaccination rollout. As of February 20th, we have provided 14,520 first doses of vaccine, and 1,934 people are now fully vaccinated with 2 doses. The 4th shipment of vaccine is scheduled to arrive later this week, and that shipment will include 16,200 doses. We will update the public once the shipment has arrived safely in the Northwest Territories. Our team has built a flexible vaccine delivery schedule to account for shipment delays, weather, or other logistical challenges. I want to thank residents for their patience as we navigated the unexpected reduced shipment earlier this month. And I want to reassure those who are eager for their first or second dose that their turn will come. I also want to touch on how fortunate we are to be expecting enough vaccine for 75% of our adult population by the end of March 2021. The NWT is still leading the country in the delivery of first doses, which are already given strong protection to about 42% of our adult population. Provided the 5th shipment arrives on time and is the full allotment, rollout to the general population in the NWT is expected to begin in late March or early April 2021. All 33 NWT communities are now listed on the schedule for second dose vaccine clinics, and that can be found at www.nthssa.ca/COVID-vaccine. Anyone who missed the initial visit and falls under one of the priority populations can still get their first dose when the vaccine teams return to their community. And if you're not going to be in your community for your second dose or now want your first dose, you can get the vaccine in another community anywhere in the Northwest Territories where there's a clinic going on. Your information is stored in the electronic medical record, and you will be assessed based on your home community's priority requirements, not the current community you live in or you are in at that time. So GNWT is continuing to deliver second doses within the recommended 28 to 42 days timeframe. If the second dose is delayed for any reason, it should still be provided as soon as possible. Residents do not have to restart the vaccine series if this happens, and the vaccine will still work. The Moderna COVID-19 vaccine is reported to be 92% effective 14 days or more after the first dose, meaning residents with only one dose are building strong protection against the disease. The Moderna COVID-19 is also reported to be effective against the genetic variants of the COVID-19 virus identified in the UK and South Africa, and that's based on blood samples from people who have been vaccinated. The COVID-19 website has lots of helpful information about the vaccine, including information sheets and videos in all NWT official languages. A comprehensive list of frequently asked questions and links to other credible information sources will be also found on the COVID-19 website. So residents can visit www.gov.nt.ca/COVID-19 to access these resources. So I also want to touch on a couple of other points before I turn things over to Dr. Pegg. Students and staff at schools across the territory will soon be entering a well-deserved 2-week March break period. In normal times, many of us will be planning to travel outside the territory during the March break. However, non-essential travel outside the Northwest Territories is not recommended right now. Transmission rates across Canada and other parts of the world are still high. We still need to get 75% of our adult population vaccinated, and we still need more data on the impact of COVID-19 variant because they are more infectious than the original strain. We still need to keep our guard up to keep the pandemic under control. And March is also one of the best months of the year to be in the North. The days are getting longer, the sun is shining more often. So let's use this time to see how much this territory has to offer. And if you do plan to travel, awareness is the key. There's currently significant COVID-19 activity occurring in many areas where NWT residents would routinely travel. Knowing the COVID-19 situation in your destination, especially if it is outside the Northwest Territories, before you travel will allow you to make more informed decisions about your own health and safety. Residents can find travel advice and more information about COVID-19 hotspots in nearby regions and the rest of Canada on the GNWT COVID website. And I do know, as we inch closer to spring, some of us are getting pandemic fatigue. As more people get vaccinated and start to build up immunity, it's natural that some of us might think that the public health measures we put in place aren't needed anymore, but they are. That's because building immunity doesn't happen overnight. We need to ensure every eligible person in the Northwest Territories has the opportunity to get the vaccine. We also need to see significant levels of vaccination and a considerable drop in transmission in other parts of Canada before we can consider easing some of those measures. So the first measures eased as vaccinations rise locally will likely to be local ones. And as vaccinations progress across the northern Canada and transmissions start falling elsewhere, more targeted and permissive self-isolation protocols and travel restrictions may be considered. We continue to track important variables as we determine when the time is right to ease some of these measures. They include knowing more about the effects of the vaccine on transmission of the virus, how much vaccines protect against variants of the SARS-CoV-2 virus. The measures we've put in place have not been easy, but they have also given us the stability we enjoy today in our territory. Where other territories have had to go into lockdowns and curfews because they eased restrictions too quickly, we have been able to avoid that. We can still enjoy a meal at our local restaurants. We can shop at local businesses, get a haircut, play indoor sports. And last week we announced we are considering self-isolation exemptions for travelers from Nunavut arriving in the Northwest Territories. So we do want to continue to move forward and not backward. And when the evidence shows it's safe for residents, we'll remove or reduce restrictions. But we still need to be careful. So let's continue to follow the public health orders. Let's continue to be kind to one another. And let's continue to practice routine healthy habits, like wearing masks, even when we've been vaccinated, and staying home when we're sick. Let's continue to keep our communities safe. And together we can defeat COVID-19. Thank you.
Thank you, Dr. Kandola, for those remarks. I'll now turn it over to Dr. Pegg.
Thanks, Darren, and thanks, Dr. Kandola. Good afternoon, everyone. I'll start with a very brief operational update about our support to the GK mine outbreak, and then we'll be able to give a short update on operations around our vaccination clinics. Our rapid response team is continuing to provide assistance for testing and for contact tracing for those who are isolating as a result of the Gachagua mine outbreak. And the lab continues to do a phenomenal job at processing the increased volume of tests that's been generated from the investigation of this outbreak. I'd also like to echo Dr. Kandola's thanks given not only to the healthcare teams who are involved in the response to this outbreak, but to the workers themselves that are continuing to isolate. With regards to vaccination, we've worked hard to schedule second visits to NWT communities where individuals can get their second dose, and others who missed their chance or wanted to wait and get a first dose. Those individuals are eligible to get a first dose when the clinic teams pass through. In every community outside Yellowknife, Inuvik, and Hay River, our clinics are open to all residents over the age of 18, so check the schedule for your community. And in our larger communities, we're still focused on second doses and first doses for priority populations. Our website, www.nthssa.ca/COVID-vaccine, has all the details on who qualifies as part of these priority populations, as well as the schedule for all NWT communities. In Yellowknife, we're currently open to anyone who's received their first dose before the 30th of January, and for priority populations to receive a first dose. We have plenty of appointments for next week and encourage those who are eligible for either group to book online. And if you're having trouble booking online or are unable to do so, to call Public Health at 867-767-9120, and someone will be able to assist you with the booking. There are also vaccine information booths that have been set up in local stores over the coming week, and people can get some help to book an appointment and get information related to the vaccine at these information booths. We'll continue to announce further opportunities, so check back at that website, www.nthssa.ca/COVID-vaccine for any updates. I want to end my remarks today with a bit of a special thank you to all of the communities and residents who have organized around and supported our vaccine clinics and teams. We've seen all kinds of support, from people giving shout outs on Facebook to the clinic staff, to ensuring our teams have been taken care of with food and refreshments, and people to making sure that teams are comfortable and that accommodations have everything that we need. NWT residents really should be proud of our current progress, and this is largely because our communities are rallying around vaccination activities. They're encouraging others, they're working to educate each other, and they're even taking efforts to make this a fun experience with photo opportunities, etc. Everybody involved deserves a bit of recognition for their efforts in protecting themselves and, most of all, their communities. Let's keep that up as we work towards our goal of offering vaccines to all residents over the next month or so. And remember, keep following the public health measures, keep your distance, wear a mask, wash your hands, and if you get sick, please go get tested. Thank you.
Thank you, Dr. Pegg, for those remarks. We'll now open up the floor to questions, and I'll do it one at a time. First off, Mariah Caruso from CKLB, do you have a question for either Dr. Pegg or Dr. Kandola?
Hello, can you hear me?
Yes, yeah, I can hear you.
Okay, perfect. Sorry about that. Thank you, everyone. I'm curious to know what priority setting, let's say, would the homeless population fall into, and how necessarily we can track their doses and their full-on immunization from the
So people living with homelessness were prioritized for the first dose as those in high-risk congregate settings, because what we know that long-term care facilities are the highest risk of congregate settings because it's a combination of those who are elderly in a congregate setting. But when you look at places like the corrections or people living with homelessness and who are congregating in a day shelter or overnight shelter, they also are at high risk, and so they were prioritized for the first dose. We are following a weekly schedule for a second dose, so when they're due for the second dose in the 28-day to 42-day window, they'll be provided that second dose, but they have already been prioritized in January, along with other assisted living situations, other high-risk groups like those living with intellectual and physical disabilities, those who are at assisted living like Mary Murphy, corrections, and then again, people living with homelessness in congregate settings. They've been prioritized in early January, and they should be due for the second dose.
Thank you, and I apologize for the technical disruptions on my end. Now, how can we ensure everyone with that circumstance is taken care of and fully vaccinated? Would you argue there's any gaps or any areas of improvement?
Those are excellent points. So there are champions. So there are people who run the overnight shelters like Salvation Army. There are people, head of the Sobering Center. There's Lynn Elkin, who heads the Inclusion NWT. So they themselves have identified and facilitated people to get their vaccine. And then we've done a general call out to the public. So for people who are living, with intellectual, physical disabilities, we also made a general call out so that they can self-identify if they're not already being referred to by these organizations. And we also have groups who are phoning organizations like the Senior Society or having booths at the grocery stores to spread the information and provide more communication. What we felt is that communication is multifaceted. You not only have to you can communicate on a website, but that's good for people who have access to internet and can navigate the website, but you also have to do personal communication, and that's where we have people in my office who are setting up almost like welcome wagons or information booths in strategic spots, and then you also have to reach out and call specific societies to identify them that way. There's more, and then there's a word of mouth, and so there's more than one way to communicate. We've also provided the CPHO email for people who have questions, and in Yellowknife specifically, Dr. Pegg has already provided the phone number of Yellowknife Public Health.
Thank you.
Thank you, Dr. Kandola. Next, Marie with Radio Taga, do you have a question for either Dr. Kandola or Dr. Pegg?
Yes, I do. First question, it was expected that 75% of the eligible population will be vaccinated by the end of March. You told during your statement, Dr. Kandola, that the vaccination will start late March or early April for general population. How do you explain the delay, and when will the 55% be reached?
So in all but 3 communities, we're already rolling out to the general population for the vaccine. And so that's already occurring now. And next week is going to be a full week, but will be all 33 communities have been identified in the schedule. And so it's mainly in the 3 regional communities, Hay River, Inuvik, Yellowknife. We may not be able to provide to the full general population. We are expecting our 5th shipment to occur in late March, and so there will be a small amount, mainly in those 3 communities, that will get their first dose. The second dose for that population will occur in likely a month from there, so probably late April. Everyone will have received at least the first dose by the end of March, and then there will be the people in those 3 regional communities, Yellowknife, Hay River, and Inuvik. That general population will get their second dose by late April. So to have a 75% doubly vaccinated, it will go into the spring, so it will go into April. But to have everyone at least have 1 dose, that is a really feasible goal that we can achieve by the end of March, because we've already vaccinated 42% of our adult population already now. So we are looking at 33% more to get to a goal of 75%.
Thank you, Dr. Kandola. Marie, do you have a follow-up question for either Dr. Pegg or Dr. Kandola?
Yes. Well, the 33% you mentioned is regarding the first dose. I made quick calculation. It seems that so you said that the 5th shipment will be received late March, and according to the calculation I made, there are still 33,000 doses to be received to vaccinate 75% of the eligible population. That was about 26,000 adults, meaning 52,000 doses total. If you receive the 5th shipment late March, you still have to administrate like about 33,000 doses. So you expect to do that by April?
In my opening speech, we're receiving 16,200 doses by the end of this week. So by the end of this week, if you add 16,200 to the 19,000 that we've already received, we would have received about 35,000 doses already. The remaining shipment would be 16,200 doses, and that would be mostly second doses for people who have received their vaccines in late February, early March, their first dose, and it will be first dose for what remains of the general population for the 3 communities, Hay River, Inuvik, and Yellowknife. But by the end of this week, we would have received about 35,000 doses.
Thank you, Dr. Kandola, for that. Sarah with Cabin Radio, do you have a question for Dr. Kandola or Dr. Pegg? No, I'm not hearing anything from Sarah yet, so I'll move on. CBC North, Joanne Stassen, do you have a question for either Dr. Kandola or Dr. Pegg, please?
Sorry, I think my phone's still unmuting here. Unmuting. I do have a question. I don't know if you can hear me.
Yeah, we can hear you.
Okay, sorry. I'm just wondering, we've seen the changes to the priority groups, like gradually over time, adding things like people who are obese, people with complicated diabetes, and now eventually, people with diabetes in general. So how have the decisions been made around adding those groups in? Is it based on guidelines from outside of the territory? Is it based on information that you guys are kind of crunching yourself? How have the decisions around opening up the priority been made by the GNWT?
Thank you, Joanne. So those decisions were made by looking at the Public Health Agency of Canada guidelines. So for most of the communities in that NWT vaccine strategy for priority populations, we've kept it pretty open for chronic disease. It is pretty easy to know who's 60 and older, but with the chronic disease, we talked about the general categories that we know increase risk for severity, such as liver, lung, heart disease, kidney disease, people with diabetes, blood pressure, BMI over 40, and people with immune compromising conditions or are taking medications that give them weak immunity. So these are the general categories. When it came specifically to Yellowknife, we had to be very specific and target of the chronic disease, be really specific of who were the most severe of that category so they could get their vaccines first. And so the decisions around which diseases cause an increased severity, if these people were to get COVID, if there were an increase in hospitalizations, increase in ICU admissions, increase in death, we looked at the Public Health Agency in Canada guidelines, and we also looked at the Centers for Disease Control. After we had saturated the moderate to severe people in these chronic conditions, we were able to open it up to other categories, so around diabetes and blood pressure, to open it up to allow other people who also have an increased risk to get vaccinated. And so that's what you've been seeing specific to Yellowknife, these priority populations having open clinics to allow them to book, and then the definitions were able to be more broad and more inclusive, just because we had more vaccines allocated and we had realized that we had reached the most severe first, and we were able to open up to the other people with chronic conditions that still put them at high risk of severity.
Mm-hmm. Okay. All right. Can I ask a follow-up?
Yeah, yes, you can, Joanne.
I'm just wondering as well, like we're hearing out of Ontario right now that they're not anywhere near as far ahead as we are in the other provinces right now, but we are hearing Ontario talking about prioritizing essential workers. So obviously our healthcare workers are immunized, but at what point will the priority be opened up for people who are there on the front lines in grocery stores or in places like that?
That's you're dealing with the National Advisory Committee of Immunizations, stage 2. And so the prioritization are frontline workers who are essential workers but cannot work remotely, and that includes cashiers at grocery stores, includes teachers, includes people at day homes, includes people work for Postal Canada, a whole host of people. And so that priority group will be opened up when in the 3 regions, Hay River, Yellowknife, Inuvik, what you'll see is that when the vaccines roll out here, they'll be providing a second dose to everyone who got a first dose, and they will be expanding the priority populations to include that group. All the other communities, it's open up to anyone 18 and above. So the specific stage 2 prioritization is for these 3 communities, Hay River, Yellowknife, and Inuvik.
Okay, thank you.
Thank you, Dr. Kandola, for the answer, and Joanne for the question. Kevin from True North FM, do you have a question for Dr. Pegg or Dr. Kandola? Yeah, I'm not hearing anything from Kevin at the moment. I'll move along. Radio Canada Yukon, is there? Do you have a question for either Dr. Pegg or Dr. Kandola if you're on the line? Moving along. With CBC North, Hannah Paulson, do you have a question for Dr. Pegg or Dr. Kandola?
Hello? Hello?
Hi there. Is this
Okay, this
Claudiane?
is Claudiane at Radio Canada. Can you hear me now?
Yes, I can, yes. Have you got a question
sorry
for Dr.
about
Pegg,
that.
Dr.
I'm
Kandola?
confusing here. Yes, I was hoping to get clarification on the travel exemptions that are in place and what is being considered as far as Nunavut and the Yukon. So what is currently possible and what is considered for the coming weeks or months?
So the current exemptions from self-isolation we have in place are people who are traveling from Nunavut communities. And for people traveling from Nunavut communities, they still have to submit a self-isolation plan and ask for exemption from self-isolation. If they meet the conditions that they're not symptomatic, they're not named as a close contact of a case of COVID, they have not been a part of an outbreak cluster, there is no community-wide transmission where they're coming from, there is no travel restrictions in the community they're coming from in Nunavut, and they're not coming from an industrial site, such as a mine, they can apply for an exemption, which means they'll be exempted from self-isolation, and any household members they're staying with would also be exempted. So that is in place for Nunavut. Those are the only exemptions we have to date. I know there's been questions around Yukon, and the government of Northwest Territories does recognize that there are strong ties between communities in the Northwest Territories and the Yukon, and that many of our residents have friends and family that live in the Yukon and vice versa. But we also recognize that residents have made sacrifices by refraining from non-essential travel to the Yukon so they can keep our communities safe during the pandemic. However, at this point, the Yukon does require that anyone entering the territory isolate for 14 days, with some exceptions. And the Yukon must decide what works for their territory to keep their residents and communities safe. So at this point, if you were from the NWT going into Yukon, you would have to isolate for 14 days. If you're transitioning for Yukon, you will have 24 hours to get to your point of destination, but that does not allow you to go into Whitehorse to go shopping. You would have to take the most direct route, only fuel up and have the essential supplies and stay at hotels along the central route. And if you're going to transition for 24 hours, at this point, the Yukon hasn't submitted a timeline or any direction of whether they're going to ease their travel restrictions. And it is not, has the CPHO, I don't have jurisdiction of what happens in NWT. But if the Yukon were to ease their travel restrictions, for NWT, what we also have to take into consideration is the route that Alaska travels through Yukon to go into BC, and that also people can enter the Yukon if they're traveling through Alberta and BC. And so that kind of mix of outer territory and in territory is not something that we find in Yukon. In Yukon, pretty much anyone traveling from the Nunavut into NWT have are not under a 14-day isolation. So should the Yukon decide to do the travel restrictions, we just have to take into considerations these issues around the border to Alaska and the border to BC and the entry from other provinces.
Thank you, Dr. Kandola. Claudia, do you have a follow-up for either Dr. Pegg or Dr. Kandola?
I do, yes, thank you. So once you've reached the herd immunity that you're seeking, so 75% by the end of March or April, will you be considering opening NWT to other parts of Canada to allow perhaps some tourism?
Thanks for the question. One of the things we have to look at is in terms of how many adults we vaccinate. We wouldn't know that number until late April because it's 2-dose vaccine. We will also probably by that time have more information on transmission. So if someone was to receive the vaccine, it does protect them against disease. Moderna has an excellent record for protecting against severe disease. What we don't know is whether we can transmit the infection. We would need to look at Canada also increasing their vaccination rates and what's happening to disease transmission and what's happening to the variants of concern. There is a consideration that a number, the one population that is not vaccinated are those 18 and under, so they would be still susceptible to COVID or COVID outbreaks. And so these are all considerations we need to put in place around whether people still have to isolate for 14 days before they are free to move about in NWT. And so those questions, still need more data and evidence, and we're not really going to get to a full herd immunity till late April. So between now and then, there's going to be a lot more information around data transmission, vaccine coverage for the rest of Canada, and also the variants of concern to see if we were able to contain them and if they're not posing any risk to people who are vaccinated.
Thank you, Dr. Kandola, for that those answers. Paul Bickford from Northern News Services, do you have a question for Dr. Pegg or Dr. Kandola?
Can you hear me now? Can you hear me?
Yeah, can hear you fine. Thank you.
Okay, perfect. Dr. Kandola, this is a question for Dr. Kandola. Dr. Kandola, I understand that your office has been working with the organizers of Kamba Carnival at Kandole First Nation and about the upcoming carnival. And I'm just wondering if you could. If you had I'm sorry? Can you still hear me?
I can hear you.
Okay. Is that Dr. Kandola?
Yes.
Okay, Dr. Kandola, I'm not sure if you heard the first part of my question. I understand your office has been working with the organizers of Kamba Carnival with Kandole First Nation for the upcoming carnival, and I'm just wondering if you could talk about if you're aware, if you can talk about the major changes, the efforts that the organizers there are making to run a safe carnival there, and the changes that have been made to the carnival.
So so my office has been working with the organizers, looking at their exposure plan. A number of the activities will be done online, and the other ones will be done in a way where they can maintain appropriate physical distancing and limit any possibility of causing enough of a congregate setting to have COVID transmission. The actual specifics around this particular Samba Cake, this particular carnival, I would have to get my my Chief Environmental Health Officer to get back to you specifically, Paul, on how they dealt with this specific exposure plan. But I have, from the briefing that I got, it is they're going ahead with this carnival, but it'll be done in a way that is safe and a way that maintains public health measures, but still allows activities to continue safely.
Okay, the follow-up for that is, I know some carnivals and other events around the NWT have been canceled, but do you think that Kamba Carnival proves that even a large carnival like that could go ahead if the organizers take all the necessary steps, extraordinary measures to do so? Could that be sort of like a template for other carnivals?
If the organizers for this carnival are willing to share their exposure plan, it would be a great template and guide. What's the main issue with the carnivals is just at this point we can't have a carnival that has 500 people or 1,000 people. It's just too much at this point, and so then we want to encourage later on in the year to have more activities outdoors, because when it's outdoors we can actually increase the number, but we can't increase the numbers of what we used to have until we advance in our phases. The people who are organizing carnivals, they can also reach out to Protect NWT and present their exposure plan, and if they need to have more, they can ask for an exception to vary. And then the environmental health officers, we have some placed up in the Beaufort Delta, some in Hay River, and some in Yellowknife. They'll assign someone to work with that person to come to an understanding of like how they can have their event organized, but then keep it safe. So the one at the KFN has met the requirements and is going ahead, but each area has very unique situations. They have unique buildings, they have a unique environment, so they're just encouraged to reach out with a proposal, and they'll be assigned an environmental health officer who will work intimately with them to make sure that they can run their carnival in a safe way.
Thank you.
Thank you, Dr. Kandola. That response. Simon Whitehouse from News North, you have a question for either Dr. Pegg or Dr. Kandola.
Sure. Good afternoon, Dr. Kandola. I was just wondering if you could talk a little bit about the purpose of vaccine certificates that public health can give to people who've received both doses. Like, what form is it in? Is it going to be needed in the future, like to enter public places and so on?
So this is more of a national level question. So what we know in the Northwest Territories is that people get vaccinated here, that the electronic medical record is a permanent storage space for the recording of their vaccine. In fact, if you got your vaccine in Hay River, but were in Yellowknife for the second dose, they can basically go into the electronic medical record, retrieve your record, and know when you got the first dose and where you got the first dose, and be able to provide the second dose. This is a feature that we have uniquely in NWT that is that other provinces and jurisdictions don't have. So this is where we're keeping a permanent record around the vaccine certificate or vaccine passport. We ourselves in NWT have not generated that. I think this is more of a national discussion, because if someone in Ontario got vaccinated, they wanted to come in to NWT, and if we had more data on transmission and found that people who are doubly vaccinated don't transmit the virus, that could be a game changer. But that discussion, I think, is not at particularly for Northwest Territory. I think it will have to come at a higher level, at a federal level, because if people choose to go that route, it would have to be standardized. But as far as I know, we're not doing anything around that here in NWT, and we'll just monitor for discussions at the federal, provincial, territorial level.
Sorry, Dr. Pegg, I think you have something to add there.
Yeah, just to add a little bit to that, everything that Dr. Kandola said is exactly correct. We have had some people requesting proof of vaccination for travel or for various other reasons. And there is a form for this request. It needs to be a formal request for a release of health information. And that's available through the Department of Health and Social Services website, where you can find the process there for requesting a copy of part of your electronic medical record, which would have that vaccination info on it.
Thank you, Dr. Pegg. Simon, do you have a follow-up for either Dr. Pegg or Dr. Kandola?
Yes. On another issue, and I'm not sure if you've addressed it, Dr. Kandola, but what are the complexities right now of trying to prepare summer students coming up from, say, Alberta or BC? Like, can they get a vaccine out of province and come in to work and then leave again? Or maybe can you just talk about that?
So first we can talk about GNWT students who will be returning in April. We've been really fortunate in NWT because we've been able to advance so many different stages where in other provinces, they're still dealing with priority populations such as the seniors. Our first priority when it comes to our GNWT students, they may be in provinces or other parts of the world or where they have not been able to access their vaccine because they're not in line for the vaccine. I want to reassure those students that when they come back that they will get their vaccine here, and if they're here with after 28 days, they'll get their second dose. When it comes to other students, what we do know, what the federal government has said, that everyone who wants a vaccine should be able to receive a vaccine by the end of September. And then some different provinces may have may be able to prioritize a lot quicker. We look at each case differently. So if non-residents are coming up here and they're recurrent people who travel here and work here on a regular basis, we are open to providing them vaccines. I don't know how many students we get out of territory. Typically, some students have been students who are from GNWT whose address to here, so they'd be eligible for the vaccine. But if there's unique circumstances of some students who are not from GNWT and they're going into small communities, we would definitely be open to making sure they're fully immunized.
Thank you, Dr. Kandola. Recognizing we've got 10 minutes left in the meeting, but wanted to check on a couple that reporters I'd asked already didn't hear back from. But Sarah with Cabin Radio, are you there? Do you have a question for either Dr. Pegg or Dr. Kandola? How about Kevin with True North FM? Do you have a question for Dr. Pegg or Dr. Kandola? And also checking on with Hannah Paulson if she has questions for either Dr. Kandola or Dr. Pegg. Well, I'm not hearing anything at this point. So I'd like to thank everybody for attending this public health officials briefing.
I think I don't have any microphone issue and I still have a question.
Okay, yes, Marie, you can ask one more question, please.
Yeah, so my question is for Dr. Kandola, and I'm sorry, I indeed made a mistake in my quick calculation earlier. So my question is, will the NWT citizens who receive 2 doses of vaccine need to isolate for a full 2 weeks if they travel out of the territory? And if so, what scientific evidence support the need for a full 2 week of isolation for the people who are fully vaccinated?
Thanks. So what I'm looking for is the data transmission evidence to show that if 2 people if you received 2 doses of your vaccine, whether you actually transmit the virus. So it's the data that everyone's looking for right now, because it's not just specific for the Northwest Territories, but if we can show that if you and I, we get fully immunized with our messenger RNA vaccine, and 2 weeks after that we achieve peak immunity. If I got exposed to COVID, I know it's got a pretty good efficacy, and I know they will be protected, but can I still be infectious to other people? The reason why that question is important is follows Marie. I suppose we are seeing an increase in variants of concern, and let's suppose I traveled down south and I came back and I was doubly vaccinated, but I didn't isolate. But I was exposed to a variant of concern when I was in the south, but I wasn't aware of that, and I'm moving around, and I'm going from, let's say I go for a volleyball practice, I go to a restaurant, I attend a church, I go to a school event, but I myself am not sick, but I'm carrying the variant. If I'm not transmitting there's no big deal for there's no risk. But let's suppose I was spreading it and I didn't know. Well, there's a lot of vulnerable people, especially in some settings like schools where they're not vaccinated, and that's where you could cause outbreaks and disrupt school and learning activities. So these are questions that we need to kind of know and wait for the data, so then that we can with confidence say to people, if you're 2 weeks past your second dose and you're traveling and you're coming back, and you don't need to isolate. And if there are variants of concern, if the vaccine is working effectively for the variants of concern, and it's not an issue, then we can actually safely say you don't need to go for the 14-day self-isolation. So the scientific data you're looking for is the same scientific data I'm looking for as well.
Thank you, Dr. Kandola, for that. Thanks for the question, Marie. At this point, I'll like to thank everybody again for attending. Appreciate the follow-ups and the response to the public health officials briefing that we hold every 2 weeks. Again, if you have any follow-up questions, you can email me at darren_p_campbell@gov.nt.ca. And thank you, and everybody, and have a great day.